Hey, I want to thank everyone for being here tonight. My name is Lee Storrow. I'm currently a junior at UNC Chapel Hill and on the North Carolina American Heart Association State Advisory Committee. And I just want to reiterate a lot of the stories we've heard here this evening. We've heard devastating, horrible stories about what these cuts are going to do to people across North Carolina. When we look at the cuts in healthcare, when we look at the cuts in education, these kind of cuts are going to set our state back decades in terms of the progress we've made over the last 20 years. And I just want to take time to reiterate the comments Jonathan made in terms of raising the cigarette tax. It's very rare that the Heart Association gets involved in policy decisions on a level of talking about tax increases. So often when we're doing lobbying work, we're supporting health initiatives, increased funding for prevention methods, things of that nature. But the thing is, we know that raising the cigarette tax it's a win-win situation for every single person involved in North Carolina. We at the Heart Association are supporting a $1 increase in the cigarette tax. We currently in North Carolina have one of the lowest taxes in the country. And again, to reiterate what Jonathan said, we know increasing the tax leads to less consumption. We know that when the tax increases, youth smoke significantly less. Well, obviously that's good from a health perspective, but from the state's perspective, that means we spend less money in the long run. That means we spend less money when people die from lung cancer and heart attacks 20, 30 years earlier than they would have otherwise. On top of that, though, let's look at the immediate effects that we'll have in this session. According to the Alliance for Health, we can generate $329 million in this year alone by increasing that cigarette tax. Now, I'm not going to tell you that's going to fix all our problems because we know the numbers, it's not going to. I'm not going to tell you that that's the only solution we have looking at this budget crisis, but that can be a large portion of attempts to raise new revenue. $300 million, if you look at the numbers, can save almost all of the cuts when you look at Department of Health and Human Services and a lot of the other health problems we face. And I'm not going to advocate that we would put that money toward one program or another because I think when we hear the stories people say today, any kind of cuts would be devastating. But that's money that can go toward education, it's money that can go toward programs, social services that people here have talked about. That's the kind of solutions we need from Raleigh this year. And again, as part of a larger attempt to raise revenue, this state can increase the cigarette tax and should increase the cigarette tax because we save money and we ensure that we have a healthier North Carolina. Now, I want to take time to speak to the legislators who are in this room and to the legislators who will be listening to this in the future. We sent you to Raleigh to fight for us. We sent you to Raleigh to fight for the people of North Carolina, and this is a session that we're going to demand better of you. You have to make hard and fast decisions, and you need to and have to make decisions to raise revenue. We know that there's smart and there are effective ways you can raise revenue that can have larger impacts about health, but we also know that people's lives will be crippled, jobs will be lost, healthcare will be in an abysmal state if we do not increase the revenue so that we can provide for the services that, as of now, you're proposing to cut. Thank you.
Hey everybody, my name is Dante Sturbino. I'm an organizer with UE Local 150. It's the North Carolina Public Service Workers Union. I organize with workers that work in the state psychiatric hospitals and the development disability centers. As y'all probably all seen the past year or longer, the incredible horror that workers and patients go through, and the amounts of injuries and the amounts of difficulties they have to maintain a safe environment. A lot of that due to understaffing. One of the current proposals in the budget would cut in the Senate and actually in the Mental Health and Appropriations Committee would actually cut about 452 positions around the state in mental health and development disabilities, which would further make it impossible. Literally, I was talking to people today, and they would literally have to dump people on the streets, bring people in wheelbarrows to the homeless shelters and the prisons because there wouldn't be capacity in the state. Not only with that, but also in the UNC system where we organize with workers, as we're seeing these sprawling amounts of administration. Like they did a study at UNC, and there was 9 layers of administration between a housekeeper and the highest boss. 9 layers of administration. And at NC State, the amount of administration has grown 19% between 2000 and 2005. And we're looking at cutting 11% into faculty and professors and housekeepers and groundskeepers. Why not cut these administrators who are making these fat and these fat wages and doing unnecessary work. So there is real places. We're saying, do not cut on the backs of frontline workers. Really look into higher level administrative, excessive positions around the state as well. But not only that, wealthy people and corporations in the state have been getting off with lots of tax breaks, and it's time for that to end as well. Corporations already receive over $1 billion in tax breaks. They want to further decrease that. The Senate revenue plan proposes to decrease it by another $325 million. That's completely unacceptable. It's not going to save jobs in our state. And so we have a statewide petition going around to increase taxes on big multinational corporations, but also to increase taxes on the wealthy, single earners as well. And the last point I want to reiterate, I heard a sister earlier speak about the need for collective bargaining for public sector workers. We are one of the only states, along with Virginia, in the country that doesn't have it. And it's time for workers to have input, the decision-making, workers to deal with mental health patients, workers that deal with students in the schools, workers that deal with this stuff day to day, to have some direct input into the budget decisions of their institutions and to show where is necessary, what are not necessary. Right now, we don't have that mechanism. Right now, resources are being depleted from working class and oppressed communities. And if workers had the power to have input on a contractual basis to the resources and to decision making, this wouldn't be the case. So collective bargaining, tax the corporations, and don't balance the budget on the backs of frontline workers. Thank you.